Hi, I'm Danica. I live in Denver, Colorado. Before I was diagnosed as a type 1 diabetic, my life was great. I was active, I played basketball, volleyball, and track year-round. I was student body president, and I was really involved with my community. Being diagnosed at 14 was nothing I asked for. I was not prepared for it. I didn't understand diabetes. And quite frankly, I told my mother, I don't have time for this. When I was diagnosed, my doctor really just told me what I was doing. I was being told that, hey, you're gonna go on insulin shots and you're gonna have a restricted diet. I wasn't really given options, but I was just given a bunch of don'ts. Once I was on treatment, I realized how important it was for me to really build a partnership with my clinician, because you have to be the strongest advocate for yourself, and I know my body best. I truly understood what diabetes was years after my diagnosis. In my opinion, I never really received the detailed patient education piece on it. I'll say about 5 years in is when I really feel comfortable saying, this is diabetes, this is what I'm dealing with, and this is what I have. When learning about Afrezza as an inhalable insulin, it was fascinating, just understanding the innovation behind a drug that I've been taking for years at that time. So I was just surprised to figure out that I could inhale my insulin and it would work. I wanted to bring Afrezza up to my doctor because it was a rapid insulin that worked within 15 minutes. So understanding that, hey, an insulin can work fast and I can eat or give myself insulin right when I'm eating and not waiting. Afrezza can be taken at the beginning of meals, even if it's unexpected. Before starting Afrezza, my doctor explained the side effects. She did have a concern just with, as a child, having allergy-induced asthma. I had not had any symptoms or flare-ups in over 15 years, but she just wanted to make that as a concern that I might cough after. Once I started Afrezza, I did have the coughing side effect. It wasn't a lingering cough, I just coughed a couple times after, and after working with my doctor, I found out that was expected, and it's really just the clearing of your throat. Personally, I found that I have more flexibility in the timing of my meals. I wish other people in the diabetes community knew that Afrezza was a fast in and fast out insulin. It really simulates what the human body does. In my early 20s, when I started Afrezza, it really opened up the way I was able to travel just a little bit more mindfully. I travel for a living and I'm on the go, and just being able to pick the right color for my doses and just take an inhalable insulin has been helpful for managing my diabetes on the go. The inhaler device is small and portable. Afrezza has made traveling really convenient for me as I hit the road. It's far less cargo that I'm having to take with me. In addition, the refrigeration piece of it doesn't have to constantly be refrigerated, so I'm not having to carry always a cooler with me. So it's really just made travel light. The greatest lesson I've learned with this journey of being a diabetic has been to be proactive. There's measures you can take to really manage your diabetes, and Afrezza is one of those that helps me do it. This is my experience, others may be different. The advice that I have for others living with diabetes is really to stay empowered, be your own advocate, and try the new things.
Afrezza is a rapid-acting inhaled insulin used to control high blood sugar in adults with diabetes mellitus. Afrezza can cause serious side effects, including sudden lung problems and low potassium. Afrezza is not for patients with chronic lung disease such as asthma or COPD. Tell your doctor if you smoke, recently stopped smoking, have ever had kidney or liver problems, a history of lung cancer, or if you're pregnant or breastfeeding. The most common side effects are low blood sugar, cough, and sore throat. Severe low blood sugar can be fatal. Do not replace long-acting insulin with Afrezza. Afrezza is not for use to treat diabetic ketoacidosis. Do not take Afrezza if you are allergic to insulin. Talk to your doctor before changing your Afrezza dose. Blood sugar may need to be checked more frequently. Please see accompanying full prescribing information for Afrezza.